I started to recognize the impact of my sleep and late food. So the
Mhm.
sugars, just the spike of stress of my body working overtime to process what I put in my mouth up to a certain point in time. The also the negative impacts of alcohol also was eye opening. I think that's something a lot of people
Mhm.
notice that they change once they start tracking how it impacts the body. And it's extremely eye opening to me just to watch how that has altered some of the decisions that I make in a day to day basis.
Yes, I think that's what needs to happen for people. They need to have an aha moment. It sounds like you monitoring your sleep has made it easy for you to appreciate what things affect your sleep and how that affects your day to day life. And that's what most people need to do. They need to address the issue and figure things out for themselves. A lot of people say, "Oh, nobody sleeps well. I'm just like everybody else." Like, when you go to airports and sporting events, all the food is junk food, and everybody else is eating it. So you feel like you're like being like everybody else. No, if you want to be that one person who's healthy now, who's enjoying life now, and who's going to be healthy and sharp in their 80s and early 90s, you don't want to have that pattern. So you need to figure out how your daily routines are affecting your brain. And sleep is one of the most important things because when you're sleeping, your brain goes through a rinsing and cleaning process. Your sleep is not a passive experience. Your brain is busy putting away the trash. It's a waste management system that's in full operation during deep sleep. So you need to prioritize your sleep and realize this is not just wasted time, it's an active brain refreshing process that takes time to happen, and you have to allow it to happen. Your memories get consolidated, your brain recovers, the waste is clear, and so you do want to have that um, process to happen fully. Imagine you go to New York City and the trash is not collected for 2 weeks. Now imagine the trash is not collected for 2 months. Just picture the mess that will happen in that city. The brain is not that different. Every night, there are special processes, a rinsing process that happens and takes away the byproducts of chemical reactions which become toxic, as well as the amyloid, as well as other things that need to be removed. Because there's nowhere, your brain is a closed entity inside your skull, and things need to be actively taken out of the brain. And that's called the glymphatic system. And the glymphatic system is mostly active during deep sleep. So make sure that um, you, whether you monitor your sleep or set a timer to go to bed exactly the same time most nights, like plan to go to bed 10 p.m. Most nights get up at 6 a.m. or 11 to 7, something like that.
Yeah, I've read recently that it's more important if you had to choose between the two, it's more important to wake up at the same time every day than it is to go to sleep at the same time every day. For those of you that struggle to make one decision or another, any opinion on that statement? I don't know how true the research is, but I've been reading a couple of articles about it recently.
Some people are morning persons and some people are night owls. And so you want to stay within your own circadian rhythm, but be consistent. You need to be flexible. I mean, sometimes there's a party and you're out later than usual, and sometimes you've been just way too tired and you want to sleep in on a weekend. I think you need to be nice to yourself. You need to enjoy life. I mean, what I've done for myself is to make minor tweaks in my day to day routines to be able to enjoy life and do all the things that I know are important for the brain. So I have a routine. I go to sleep around mostly around 10 ish, and I wake up around 6 ish. But you know, if something happens and doesn't happen per protocol, that's fine. Life goes on.
Yeah, I think I'm about the same. It's funny, my wife has always prioritized an early bedtime. and significantly early, to the point where I think it was one of those things we might have argued about for the first decade. I was like, just stay up a little later. Let's watch a movie. Let's and she was just prioritizing it. And now I've learned by getting on her circadian rhythm and being more aligned, it helps us be more aligned. There's little things that are super simple, but that sleeping is so valuable. We're all in a better place that way. So it took a major change for me though, because I would try to max every day in the old days.
One of the things that I have come to appreciate in taking care of patients is that sleep is one of those things that when you improve it, you see results quickly. When you change your diet, your brain is getting healthier, your brain is cleaner. You may notice like a 5%, 10% in your mental clarity, but when you improve your sleep, you may experience a 30% mental clarity. And you wouldn't know until you improve your sleep. Because if you always walk around being sleep deprived, you have accepted that as your own baseline. This is where you usually are, and this is where you expect yourself to be in terms of how quickly you process information, how well you remember things, how well you can get things done. And when you have a regular 7 to 8 hours of sleep, you can see that you're actually more productive. So you actually see an improvement in your performance in a short notice.
What a hot topic and discussion point today is GLP-1s. We talked about diabetes 3. We talked about the link between the glucose and Alzheimer's and um, the medical connectivity and the power of sleep. If you're looking at somebody utilizing a GLP-1, an Ozempic, any of these things we're seeing mass use now, and it's very recognizable. Do you see that as a positive, or do you see it as something that may be just masking a challenge that will appear later?
I think that treating obesity is extremely important. And I've seen lots of people lose a lot of weight and become healthier with these GLP-1 agonists. And so I think it's a good thing. I think you should not get to that point and needing it. Unfortunately, what happens is that people who take these drugs find it difficult to go off of them and they become dependent on it. So I think that if you are significantly overweight, you should use GLP-1 agonists, but you should make sure that you exercise and you watch what you eat and that you taper the dose and then you are on your own in the long term. However,
So you're
in
le
general, I'm in favor of interventions that address obesity.
It seems like it would be a great quick start, as long as you were going to be able to continue the lifestyle that you need to continue. So just to say it again, if we leverage and utilize it to change the obesity that someone is sitting in today, and they can lose weight, and then they can taper off the GLP-1 usage while incorporating a better diet, heavier exercise, better sleep, all the things that losing that weight should actually aid in, it could be a great resource. If they stay on it for a long period of time, that's where we really don't know all the results of what that might look like into the future.
Yes, I think that you summarized it pretty well.
Well, I think it's something that's very popular right now. I think it's also very popular with my generation. So I'm 47 years old. I think that the 40 to 50-year-olds have usually hit a certain point where maybe we aren't all in love with the version of our body and ourselves that we have today. And I just recognize that I'm noticing it, and the usage increase at a substantial rate even with younger people today. And so I've just I want to have the conversation, because I don't want to ever impede someone from having an opportunity to live a better life and to live a longer life and to live a healthier life. But I also want to make sure people aren't looking for the results that they get from something that isn't going to provide the longevity of results they're looking for. And so to me, it's a very important topic to have a conversation about today, because it's new, and sometimes when things are new, we wake up years later and we go, "Wow, I had no idea that was gonna be something that was gonna impact me in the way that it did."
Exercise has many benefits above and beyond helping you lose weight. And, healthy dietary choices are very important above and beyond the size of your belly. So, these medications reduce your appetite and make you eat less, but you need to exercise in order to have a healthier brain. And all your body organs function better when you exercise regularly. So, just because you lose weight, it doesn't mean you're healthier. Yes, you're healthier than if you were obese, but a lot of health benefits come from exercise and optimal sleep and dietary choices. So you need to keep in mind that you want to have a healthy overall uh, body and brain, and you can't just assume that you're healthy now that you lost weight. Being thin is not the same thing as being healthy.
So YouTube has this cool feature where they pick the next video for you, and it's right here on this screen. So I hope you enjoy this next video.